temporomandibular joint and muscles of mastication. We'll now see temporomandibular joint. As the name suggests, temporomandibular, the bones involved will be the temporal bone and the mandible. As we have a single mandible and a pair of temporal bone on either side of the skull, it is a type of single cranio-mandibular joint. We'll now see the articular surfaces. Before that, we'll draw temporal bone. The articular surface will be the articular eminence of the temporal bone and this articular eminence articulate with the condyle of the mandible. When we see norma basalis, here will be the foramen magnum and the condyle of the mandible. This is the lateral pole. This is the lateral pole and this is the medial pole. When we draw a line along the medial pole, it meets in the foramen magnum and the angulation would be somewhere around 145 degrees to 150 degrees to be noted. The highlights of this joint are this temporomandibular joint is a modified or atypical type of joint, atypical type of synovial joint, because all the synovial joints are lined by hyaline cartilage, whereas this is not lined by hyaline cartilage, whereas this is lined by something called as a fibrocartilage, to be noted. And this is the joint which is formed. This is the one of the synovial joint which is last to form embryologically, that is at 7th week of intrauterine life it is formed. Now we'll see about the introduction of the joint. It is a single craniomandibular atypical synovial joint of condylar variety or ellipsoid variety with a hinge type. Hinge type is where in the articular fossa the condyle articulates. The action is uniaxial. This is similar to knee joint, wrist joint. but differing from knee joint drift joint by fibrocartilage lining of articular surface. Okay, now we'll see the divisions of the joint cavity. There is an articular disc, fibrocartilage articular disc, that divides the joint cavity into two sections, that is upper and lower. Let us draw now. This is the joint cavity. This is the tympanic plate. Here is the condyle. Let us consider this is the posterior one and this is the anterior one. This is the intermediate one. That is, I am speaking about the fibrocartilage. Now it has to held in position. We all know the articular surface is lined by the fibrocartilage. This articular disc has to be anchored to the surface. So what happens is, this has a posterior bilaminar region. The upper bilaminar region is attached to the temporal bone, whereas the lower is attached to the condyle of the mandible. Anteriorly, it is continuous along the tendon of, here will be a lateral pterygoid muscle. The capsule will line here along the joint cavity. So through the capsule, this anterior extension of the anterior band of fibrocartilage joins with the tendon of this muscle, and this muscle is lateral pterygoid, which is a muscle of mastication. Now we'll see the ligaments support. So let us draw the mandible roughly like this. We all know we have posteriorly the studded process, and here the spine of sphenoid. We have a ligament coming from here, that is first ligament. We also have one ligament coming from here, from the spine of sphenoid, that attaches still to the lingula. Another ligament, and another ligament, that another is the fibrous capsule covering the joint cavity, and at last is the lateral thickening of the capsule, that is the lateral ligament itself. Let us now see the names. So this is the fibrous capsule, as this is coming from sphenoid attached to mandible. It is sphenomandibular ligament. This is coming from styloid process, so it is stylomandibular ligament. This is the lateral thickening of the capsule, so it is lateral ligament or lateral temporomandibular ligament, and this is the fibrous capsule, as I said. These are the ligaments that support the temporomandibular joint. Now let us see some of the important features of this joint. As we have already discussed, we now see the articular disc. We know this is the anterior extension, this is the anterior band, intermediate zone and posterior lamina. Thing to note here is the posterior upper lamina is elastic. The lower is non-elastic. Is the anterior extension joins with tendon of lateral pterygoid muscle, as already said. This intermediate zone is the thin one, and an important thing to note here is in this bilaminar zone there is pterygoid plexus present, and the central part of this cartilaginous disc is avascular. Important. Now let us go on to the muscles acting over the joint. The muscles acting over this joint is the muscles of mastication. Let us see that. And before that, we'll be seeing the classifications of muscles of mastication. We have principal muscles of mastication and accessory muscles of mastication. The principal muscle of mastication are four, namely lateral pterygoid, medial pterygoid, masseter, temporalis, of which lateral pterygoid is an important muscle because lateral pterygoid is the key muscle of infratemporal fossa. Coming here to accessory muscles helps in mastication. Actually, mastication is a process of eating, right? Digastric muscle. Here digastric we have posterior belly of digastric and anterior belly of digastric. Mylohyoid being the oral diaphragm, geniohyoid, and a muscle to note here is burglar or trumpetus muscle, which is also called as buccinator. These are all the muscles of mastication. Principal we have 4 muscle, accessory we have 4 muscle. Now, what are the characteristic features? As we all have some characteristic features related to hamstring muscles. Likewise, we have muscles of mastication are located in infratemporal fossa. They are inserted into the ramus of mandible. When we take the ramus of mandible, let us say this is the condyle of mandible, coronoid process of mandible, this is the ramus. So everything should have at least attached to the ramus, inserted. It's not origin, remember, it is insertion. Okay, so inserted. And one thing to notice, all of these is derived from first branchial arch. As we know, the first branchial arch nerve is mandibular division of trigeminal, and the first arch artery is the great maxillary artery, which is internal branch of internal carotid artery. That is satisfied, and all are concerned with movement of mandible on temporomandibular joint. So all the muscle will move the temporomandibular joint. We'll see the muscles of mastication and movements of temporomandibular joint and the applied aspects later. Now coming to the muscles of mastication. Here, temporalis muscle is a fan-shaped muscle. Lateral pterygoid is thick conical shape. Short, thick conical shape, whereas the rest two are quadrilateral. Now coming to the origin, see, temporal fascia plays an important role in formation of temporalis muscle as well the floor of temporal fossa. Masseter, it arises from zygomatic arch. Lateral pterygoid originates from the pterygoid plate, lateral pterygoid plate. Middle pterygoid, same like it arises from superficial head of tuberosity of maxilla, and some part arises from, that is the deep part arises from medial surface of lateral pterygoid plate. Insertion, as already said, everything will be inserted in the ramus of mandible simple, and nerve supply, as this is from the first arch nerve, mandibular division of trigeminal will supply. Now we'll see the individual muscle. Here we see lateral pterygoid muscle. Thing to notice, this lateral pterygoid has upper head and lower head. The point at which they are inserted is called as pterygoid fossa. Pterygoid fovea. This pterygoid fovea is present in the condyle. Of the mandibular condyle, it is attached. It is also attached to the fibrous lining of the capsule of the joint also. This is a muscle to be noted because this muscle is a key muscle of temporal fossa, infratemporal fossa as well. This is the only muscle that opens the mouth or depress the temporomandibular joint. Important thing to note here. And then we'll go next. It is medial pterygoid. As you already said, this medial pterygoid arises from the maxillary tuberosity. The superficial head arises from maxillary tuberosity, and some part arises from lateral pterygoid plate also, lateral pterygoid muscle also. Next is masseter. This masseter arises from zygomatic arch inserted into coronary process. Temporalis muscle. Here one thing to note is this arises from the temporalis fascia and the floor of temporal fossa. This temporalis fascia is the toughest fascia. So this fascia is used in surgery called myringoplasty. In myringoplasty, this fascia is used to reconstruct the tympanic membrane. Now coming to relations of lateral pterygoid, as this is the key muscle of infratemporal fossa, we see I'm roughly drawing a diagram. Let us consider this to be the lateral pterygoid plate, a conical shaped muscle. Now we see some structures that are going up, some structures that are going down to this, and some structures that are going in between this. These are the three types of relation we will be seeing now. See, some emerging at the upper border, some emerging at the lower border, some between the gap between the two heads. Okay. Remember, anything going upper will be deep, anything going lower will be inferior. So whatever is going up will be, this is the temporal region, so it's deep temporal nerve and deep temporal artery and masseteric nerve, because masseter muscle goes here and it goes attaches itself to Here you could see the masseter muscle attached to zygomatic arch. Here if the nerve arises from here only, it could supply the masseter muscle, so it has to go up. The structure that is coming in the inferior border are inferior alveolar artery and nerve, lingual nerve and buccal nerve, because obviously we have an important structure called a tongue here. Lingual nerve has to go there, the buccal cavity, so buccal nerve and artery of the dental artery, that is inferior alveolar artery, has to supply all the alveolar process of mandible and the structures in the buccal cavity, oral cavity also. For this, these three structures comes down, is related down, whereas these three structures are related up. What is coming in middle will be the maxillary artery and as well the buccal nerve. Buccal nerve comes in middle. Okay, at last we come to movements. We have elevation, depression of temporomandibular joint, sideways movement or chewing, protraction anteriorly and retraction posteriorly. Everything happens in uni-axis. Okay, let us see. This lateral pterygoid pair is already muscle, as already said, it is only depressor. So depression is done only by lateral pterygoid muscle, whereas rest of the three principal muscle does elevation. So we have done with first movement, and second type of movement will be the protraction retraction. The pterygoid muscle will always do protraction because you could see it is coming forward here also, so it protracts. Retraction of the temporomandibular joint is done by this posterior belly of digastric and other muscles of the floor of mouth. Now we have finished the protraction retraction. Next we'll see the muscles that cause sideward, that is chewing movement. Chewing movement is actually a sideward movement. So what happens is, at one side there is elevation depression, another side there is protraction retraction, and this elevation depression, protraction retraction are only by pterygoid muscles. And again, a thing to note here is, as we take the temporomandibular joint, the articular surface the joint cavity is itself divided into two parts, as we all know. The upper part will go for gliding movements, important, and the lower part will go for rotational movements. So gliding movements, it means that is protraction and retraction. Rotational movement, it means the elevation and depression.